we're going to be sharing this link on the website so that people can join and, bypass the form. But glad to have you. Those who are joining us for the second time, happy to have you again. And those who are joining us for the first time, thank you for taking your time off. We are in our second session in this series of conversations. Before we go ahead, just to say that on behalf of the GNC Anti-Racism and Localization Working Group, we thank you again for the contributions you've given us last week and the contributions today and the contributions we'll be having in the third session. My name is Martha Nakakande. I am co-facilitating today as the co-chair of the Anti-Racism and Localization Working Group, along with my colleague Alexa. Alexa, do you want to say hi briefly?
Sure. Thanks so much, Martha. My name is Alexa or Alexandra Humphreys. I have the honor of co-chairing the Anti-Racism Working Group with Martha. I also am the Localization Help Desk for the GNC, wearing one hat, and with another hat I support on strategy development. So very happy to be here today. Back over to you, Martha.
Thanks. And I do wear the hat also of being the program advisor for Westing within the GNC operations team. We're having a series of conversations. This is the second one. And the objective of this series is to explore challenges, strategies, opportunities, and vision of local and national actors amid these challenging times within the nutrition landscape. Of the 3 sessions, we already carried out one. We're having a second session today, and we want to focus on several aspects that I'll be sharing with you. And while having these conversations, we want to call the GNC Collective to listen and take on the insights we're hearing throughout the series of these conversations. The collective, Alexa, do you want to share the next slide? We've already mentioned how you can join us. Thank you. We'll be sharing more details within the chat. Next. Next slide. Thank you. So we have 3 sessions. Last week we discussed the challenges, and again we have 2 sessions, the morning and the afternoon, so that we can try and have as many people join these conversations. And today we're going to be looking at how can the GNC Collective support local and national actors. And Alexa will take us through briefly what we're looking at as a collective, as I've already mentioned. Could we just go back, Alexa? And we will have the third session, which is sort of the culmination of the 2 sessions of where do we go to next. And that's going to be looking at the future of localization and locally led action. Alexa is going to be sharing with us, in summary, what we garnered from the session 1. But before we go there, I would like to re-emphasize that what we're calling the collective here is everyone working within the NIA space at all levels, including local and national actors, international actors, academia, donors, and any other that engage with the GNC. We welcome so much those from those representing local and national organizations. Please, this is a platform where we really, really want to hear from you, and we value all your perspectives and your experiences. Please continue to include your names, your organization. If your LNA has a website, please do share with us in the chat. If it's on Facebook, if it's on other platforms, please share with us so that we can get to learn a little bit more about your organizations. Alexa, maybe you could take us through, in summary, what we were able to gain from session 1 on challenges before we now look at what support is out there or can be sought. Thank you.
Thanks so much, Martha. So colleagues, once again, welcome. Really happy to be here together. As with most events, please feel free to introduce yourself in the chat. Specifically, if you work for a local or national organization or government or authority, feel free to tell something about your organization in the chat. Great. So, we have these conversations. There's 3 sessions, each is 2 calls, and we thought it would be useful to do a quick summary of what we learned, what we heard from you during the first session across the 2 calls. So, from the first session, we asked a question to our local and national partners, asking about if they were affected by the changing nutrition emergencies landscape in recent months. Of those that responded to this question, either in the interactive poll or in the chat, 78% said that yes, they had been affected. 14% were kind of unsure of the impact on their organization, and 7% said no, they had not been affected. When we dug a little bit deeper and we asked how local and national actors, organizations or agencies had been affected, we heard some things that seemed like we were hearing them across different contexts. Loss of staff, reduced teams, closed projects. We were hearing this from you. Also hearing about the shrinking humanitarian space and increasing insecurity. And then just the how reductions in funding relating to reduced service provision. So we're hearing this from multiple actors. Then we were also hearing about the effects of climate change, how that's been felt by some actors in recent months. Specifically in Somalia, we were hearing about displacement because of droughts. Specifically in Palestine, we were hearing about lack of fuel for transport and restriction of supplies. And then there were a couple of things we were hearing from our colleagues in Afghanistan. So forced displacement of returnees from Pakistan and Iran, and also bans on female education. When we asked the question how local and national actors, organizations, and agencies are adapting to this, or how they're innovating, or how they're responding to this change, there was mentions about diversifying funding and pursuing more support from national governments. We heard about the increased use of digital cash transfers for efficiency. We heard about organizations that were taking on new roles they hadn't taken on before, or more direct service delivery in order to meet the needs. We were hearing about organizations that are having to prioritize geographic areas and life-saving interventions, even narrowing program participants to women and children, despite other populations being quite vulnerable. And then we heard a really interesting case study from Somalia about local and national actors mentoring other local and national actors, especially on climate change and assessments. So those are some of our key takeaways from session 1. We're going to keep learning throughout the series, but really happy with everything that's been shared until now.
Thanks, Alexa. And just to reemphasize that we will be having sort of a synthesis report that we'll share with everyone once we're done with this series of conversation. Thank you. Go ahead.
Yeah, thanks, Martha. Thank you for emphasizing that. In terms of the session flow for today, it's going to very much mirror how our session 1 calls were going. We will have a series of interactive polls using menti.com. We're going to have an open floor for discussion throughout most of the call. We really welcome folks to come in and speak, turn on your mic, put your thoughts and insights in the chat, whatever way you're most comfortable engaging with us, but we really want to hear from you. And we're not here as sort of a question and answer series, but if there are questions, we can put them to the group and see if anyone has suggestions. And just before we get into sort of the polls and hearing from you all, and Martha already summarized this really nicely, but just to frame the conversation, today the topic is what kind of support do local and national actors need? But we want to make sure that we're not making this conversation so narrow that it only focuses on the GNC sort of global team that's there for technical support. Feel free to share with us what you think is important for local and national actors, more specifically or more broadly, from any actors within the GNC collective. And the way that we're framing it for this conversation is that the GNC collective includes everyone who's working in nutrition and emergencies at all levels who engage with the GNC. So these can be requests for support to international organizations, other local and national organizations, UN agencies, academia, donors, national governments and authorities, as well as the GNC team. So just know that your requests can be as broad or specific as you'd like. Martha, handing over to you to get us started with some thoughts.
Thank you. And we can already see so many people have introduced themselves in the chat, but it would still be interesting. It's really important for us to know from which organizations are you coming from. So please do go to menti.com, and we'll be using the code that's up there, which is 32504900. And you'll be responding to the question, what kind of organization or agency do you represent? Please do go in there and share your votes. Would really, really appreciate everyone joining and sharing with us the different organizations that you're coming from. We already see the few that have voted are joining in from international organizations, but we do wait for more people to vote because we are 42, I think, so far. Or maybe less if we don't count the otters, because I think we have a few of the AIs taking some notes. Please do join menti.com, whether on your phone or your laptop, and share with us. Okay. And I hope everyone is able to use Menti, but if you're really not able to, please do share with us within the chat. I see, for example, I think the last chat I'm seeing is from Razan Atta, who's from Juzur for Health and Social Development. I'm assuming that's an LNA, hopefully. So please do continue sharing with us. We do not have anyone from a government department or ministry. Okay. And we do have a couple of that are coming in from other, and I would imagine that this other represents maybe global level staff or regional level staff that are not specifying just a particular area, or maybe coming in from, yeah, I think mainly it would be global and regional. Yes, Juzur is an LNA. Thank you, Razan.
Yes, you're welcome. Good evening, everyone.
Good evening, good morning to some of us. Thank you. Yes, I think this gives us an idea of who we're engaging with today, and I'm so glad to see that we're having quite a number of LNAs, but also the UN and INGOs trying to listen into the local partners. And Alexa, we do have a couple that are actually responding through the chat. Hope we can be able to pull those results together at some point. Thank you so much. If you go on to the second question, again, we're still using the same Menti. Just again, so the next question you should be receiving if you are within Menti is, where are you joining us from? I am joining from the Eastern and Southern Africa region because I'm in Uganda. As you can see, we do have quite a number of people from the Middle East and North Africa and the ESA region, and quite a number from the other, which usually tends to be the global or larger representation. Okay, Alexa, today it seems the Middle East and the North Africa and the Eastern and Southern Africa are really, really taking the lead. And I am assuming we do still have some members that joined us on the 10th in these sessions. Just give it a few minutes, Alexa. I think I still see some votes coming in. I still see some dots. Yes. Hey. And as we do the voting, we have shared a link where you should be able to see some of the key moments and highlights of what everyone will be talking about and what has been said. So I think we're done with the voting. I don't see any more dots coming in. So we have quite a huge representation from the Middle East and North Africa region, and then from the Eastern and South African region, and then from the East Asian Pacific areas. And we also have some people from the Central Asia and a couple of more people from all the other that are not necessarily included here. And it's happy to see all of you. And it's good for us to really understand these regional representations so that at least we have an idea of who we are engaging with. So I'll hand over to you, Alexa, to continue. Thank you.
Yeah, thanks so much, Martha. I might compliment as well by saying the poll is great, but if for any reason Menti is not working for you, try to use the Menti. It's great. If for any reason it's not working, you can always put your responses in the chats. And also, even if you do the poll, if you want to tell us even more specifically where you are, the country or context, even more specific than the region, feel free to put that in the chat as well. Okay, now we're going to shift to another poll. We have more than half that have submitted for this poll. Thanks so much. The next poll or the next question, we are going to ask that only our local and national partners complete this one. So those who are working for an organization that is in and headquartered in the country they support, is from and headquartered in the country they support, or working for a government ministry or agency in the country they support. So asking only our local national partners respond to this one. But this call is all about thinking about what sort of support is needed by local national actors in order to be able to provide nutrition emergency services. But this question, just to get us started, is a question about, we saw in session one that this is a very dynamic and changing time. So we're wondering, is your organization, is there any support you're currently accessing, if any, that's helping you to address some of these challenges you're facing? You can answer this question as broadly or as specifically as you like. And feel free to either respond to this in the Menti using the code on the screen or in the chat. So I'd love to hear from your local and national partners. Is there any support that you're currently accessing to help address challenges? And I can also add that support can mean many things. Support, in addition to funding, support can be advocacy, support can be supplies, support can be partnerships, it can be coaching, it can be capacity strengthening, it can be helping develop your strategy, changing ways of working, adaptation. It can be a lot of different things. Martha, is there anything I'm missing? What else can support me?
I'm on mute. No, I think it's pretty much everything. I would appreciate if we can all look at all these as aspects of support, even level of effort of work, man hours and all that should also be looked at in terms of support. Thank you.
Okay. So again, for just our local and national partners who are on the call, work with or represent a local and national organization in the context where they work, or a government or ministry, what support are you currently accessing to help address any challenges you're facing? So someone responded, funding, partnership, capacity building, and network building. Great. If you're currently accessing those things, all of those things, that sounds like it would be really, really helpful, actually. That's fantastic if your organization is accessing those things. Yeah. I don't know if the person who put that would be interested in in coming in and speaking to that point. But yeah, we'll open the floor now for any of our local initiative partners who would like to speak to this, have any examples. If you would like to come in and speak, feel free to raise your hand or turn on your microphone and just jump in.
Hi, Alexandra. Hi, everyone. I'm Abdullahi Abikar Mohammed from Assess Development and Relief Organization in Somalia. I'm the one who submitted that information that we are assessing funding, partnership, capacity building, and networking for our organization. We are making all efforts possible to reach to donor funding and other international organizations and well-wishers to get funding. We are submitting a lot of proposals. We are interacting with other agencies and even within the local organizations to make partnerships. We are seeking also to build the capacities of the staff and other stakeholders. And as I have said, this is also an opportunity for networking. That is what I meant. And I really appreciate it. Thank you so much for this opportunity.
Yeah. Abdullahi, thank you so much for coming and expanding a little bit on that, and also for highlighting that even in challenging times, there can be opportunities. So although things have shifted and you're having to work harder to identify more funding and find more partners and bring in the capacity strengthening piece, thank you for highlighting also the opportunity for increased networking. Wonderful. We have some more comments coming in. Let's see. Yes. Haya, would you like to come in and speak?
Yeah, thank you for mentioning this important question. I saw the replies in the chat. In addition to what mentioned, of course, by colleagues, I can mention focusing on the field teams and the frontliner in the field. As you know that UNRWA, for example, is operating in 5 fields: Jordan, Lebanon, West Bank, Gaza, and Syria. And each field has its own context and its own challenges and, let's say, changeable situation. So regarding that, I would raise the issue of strengthening the coordination and communication between, let's say, the national authorities, like ministries and the nutrition cluster, for example, with the field, let's say, relevant teams. This will enhance the coordination, even if we are planning at headquarter office or, let's say, at a higher level. The direct actions or the implementation would be at the field level. So because of that, we have to ensure or strengthen the coordination and communication channels in the field. Whenever it's possible to do in-person meetings, in-person gathering together with the field, will be facilitate the actions. Also to add them in the loop of every action we are discussing, to ensure that both the, let's say, the global or the headquarter office is in line with the field plans. This is one issue. The other issue, as I mentioned, in each field has its own conflict. For example, what happened in Gaza is different what happened in West Bank. Even the both, let's say, fields have a very challenging situation, unfortunately. So, but for example, in Gaza, we have to move directly. We have to prompt, let's say, act or simplify the procedure. But currently in West Bank, we can working on strengthening the nutrition, as the nutrition cluster is doing currently. but to enhance the capacity building of the staff, because some nutrition aspects is very new to the staff, especially for UNRWA. We are working in a primary healthcare services where there's no nutritionist, for example, in the health centers. There's a practical nurse, there's a midwife, there's a medical officer, which is a practitioner or a specialist. So some of the nutrition, maybe it's obvious for us and it's easy to understand, but at the frontliner or at a field level, it's very new. Like we are mentioning community management of acute malnutrition, or we are mentioning infant and young child feeding program. Okay, we are understand as a nutrition background, but this is a very new concept for the frontliner and the people working in the field. So we have to work together to enhance the communication channels at a field level, and to include the frontliners in each local organization and authorities to best practice these interventions. Of course, in addition to the fund and supplies that needed to facilitate these programs, I would highlight this issue. Thank you.
Thank you, Haya. You touched on so many important pieces. The importance of coordination support. You touched upon the importance of having local and national actors and ministry working together. The importance of the contextual pieces. So much good stuff, Haya. Really, thank you for coming in and complimenting that. Reading a couple other things from the poll. I know BPHCC Vanadir, thank you for mentioning the capacity strengthening project we have ongoing with local and national actors in Somalia. Also mentioned that some of our local and national partners are accessing partnerships and funding, and also looking to accessing an exchange of skills, so that capacity sharing. Mentioning equitable partnership, capacity building, and mutual learning. It's very complementary to that. It sounds like at least one of our partners has a plan for building new partnerships. So that'll be incredibly important, I'm sure. Some are accessing support for fundraising, networking, and capacity building. Providing emergency services in North Gaza and Gaza. It's a provision of support. Just checking the chat. Would any of our partners like to come in and expand on any of these points or complement any of these points about any support that you're currently accessing to address the challenges that are being faced currently? If not, I think I'm going to take us to the next question, which is probably the main question of the session. We're also going to, use menti.com if possible, using the code at the top of the screen. This question, we're also going to ask that only our local and national partners complete this. So only those working for organizations that are in or from the context, or government or ministry from the context of the country. So we asked in the last question, what kinds of support are you accessing, right? So what is helping you to continue providing your NIE services to the affected population? Now we're asking the question, what kinds of support or collaboration would most strengthen your ability to deliver nutrition emergency services? Again, as Martha and I were mentioning earlier, support can mean many things. It can mean partnerships, capacity strengthening, it can mean supplies, it can mean funding, of course, it can mean advocacy, it can mean adapting our ways of working. So yeah, very open question for in the poll or in the chat, or for our local national partners to turn on your mic and speak to, but what kind of support or collaboration would be most useful for you in providing NIE services? Again, this can be support from anyone in the GNC collective, donors, national government, the GNC technical team, anyone working in nutrition and emergencies, essentially. Yeah, so colleagues, what kind of support or collaboration would be most useful to you in this time to meet these challenges? And feel free to come in. Oh, Haya, please come in. Over to you.
Yes, sorry for talking too much.
No, not at all.
يعني from point of view يعني by the way I'm here a nutrition officer working from UNRWA headquarter office in Jordan, but I'm speaking يعني in the fields of operations of the mentioned challenges by colleagues. يعني for example let's say simply I can say deliver the services, the nutrition services. يعني unfortunately in Gaza, for example, if you can take it as an example, currently the borders are closed from March. So the supply, the food parcel, the non-food items, all issues are building because we are not able to deliver the supplies or entering the supplies into the country, into the field. So let's say the collaboration is to deliver the services and supplies of nutrition related to nutrition in Gaza field. Also, the situation in West Bank, and for example, in the north area, in Jenin, in maybe colleagues from West Bank, from other organizations can address this well. In the north area, we have a critical challenge to deliver some services. So maybe collaboration and coordination between agencies is really critical in Gaza and West Bank, because there is a very limitation in let's say entering or delivering either the services or the supplies, يعني at a facility level or at let's say border level or at a field level. This is one issue. The second thing, maybe as I mentioned in the previous point, is the capacity building activity. So the capacity building activity and the training for frontliners and let's say the organization is really critical about nutrition in emergency. Either let's say it's depend on the context, but we can start as a preparedness in some field like Lebanon, Syria, for example. But to act in emergency or let's say the simplified approach in Gaza and West Bank, it's already implemented in some area of Gaza, of course. But for example, in West Bank, they did an online training and they promised to do or planned, sorry, to do in-person training. But I think maybe simulations or let's say piloting some of these services is really critical in this situation. يعني this is what I can mention. Also to work on, let's say, if we can together implement a preparedness measurement for nutrition emergency to determine plan A or plan B. If this is the situation, we are prioritizing these services. Of if plan B, if the situation is getting better, we are planning these services. So planning, yani. So if briefly, it's delivery of services and supplies. Secondly is the building capacity of the staff. Thirdly is to plan. Preparedness plan is really critical in this situation. Thank you.
Hi, thank you so much for coming in and speaking to those points. Have noted the importance, how valuable it would be to have that collaborative support in order to provide the service delivery in Gaza in this really challenging time. Also, the need for capacity strengthening as things have changed really quickly. Yeah, thank you so much for coming in on that point. Colleagues, I'm just taking a look at some other notes, but if anyone would like to come in. Did someone, I feel like I hear someone speaking. Would someone like to come in on this point? The floor is open if anyone would like to speak. Just looking as oh, Haya, would you like to come in again?
Well, yeah, one other point, sorry, I forgot it. It is about the nutrition information system. To have a clear plan between, let's say, organizations and the nutrition cluster about the information system. Also, let's say some gathering or data collection or related to the information system is needed to be trained by staff also to focus on building capacity of the information system and the surveillance system in the field context to better, let's say, understand the situation in this country. And for example, in Gaza, the high food prices is affecting the ability for people to purchase food, and this is affecting, for example, the nutrition situation. But how much this is affecting them, the prevalence, there's an IPC analysis and there is a surveillance, but yani, to compare it with the previous years is not existing, for example. But if we already have surveillance system in previous years, for example, in West Bank and Gaza, this is can tell how much it's worsened the situation is get. Yani, this is point also to mention. Thank you.
Yeah, thank you. Thank you so much, Haya, for highlighting that as well. The NIS piece and the surveillance piece, I'm imagining that would be incredibly important context. So some other things are, oh, good. I see another hand. Khazan, please come in.
Yes, good evening, everyone. This is Razan Atta from Juzur for Health and Social Development, which is a local NGO in Palestine. So mainly the kind of support or collaboration we provide is delivery of medical services, which includes, actually we have 30 shelters in North Gaza, South Gaza, and Gaza, where we provide all types of emergency health services, including child health services for communicable and non-communicable diseases, emergency preparedness, rehabilitation, services for pregnant women also. We also have 5 community health centers. Additionally, the type of support we provide is, let's say, emergency preparedness for the West Bank. Actually, we have implemented a community-based malnutrition, community-based acute malnutrition and infant young child feeding training in partnership with the Ministry of Health, UNICEF, and Action Against Hunger, where we provided 5 online sessions, and it will be followed by face-to-face sessions in the upcoming month. Additionally, we have the helpline service where people from Gaza and West Bank call to ask for services, whether it's nutrition, psychosocial support, first aid, emergency, child and maternal health. And yes, and I think and also we provide the supplies in Gaza with the support of UNICEF. We provide supplies for children and pregnant breastfeeding women, mainly SQLNS, high energy biscuits, and ready to eat complementary food. Thank you.
Thank you so much, Khazan. It's great to hear
Thank
about
you.
the wonderful work that you're doing. And thank you for highlighting as well some of the support that you're currently receiving around capacity strengthening and even supplies from UNICEF.
Thank you.
Khazan, just to complement that, is there any support that Juzur needs to be able to strengthen your NIA services, your nutrition services?
Yes, I think I mentioned the delivery of supply and medical services. Is that what you mean? And capacity building.
So you need some support in this area?
Yes.
Okay, great.
Yeah.
Thank
And
you
I
so
just
much.
want to mention one last thing. Also, we provide psychosocial support for children in Gaza and in the West Bank. Because of the ongoing situation where many children face stress, they face traumas, anxiety. So this is one of the important services we also provide, psychosocial support.
Thank you for adding that, Rizwan.
Thank you.
Great. Thank you so much. Colleagues, the floor is still open. If anyone would like to come in, any of our local or national partners, if you'd like to come in and speak to any kinds of support or collaboration, that would be helpful to you. Looking at what's been submitted on the screen, funding would be really important for NI services in Somalia. A colleague had mentioned strategic partnership and training and development is going to be really important. being here as well, working in Somalia. You have a protracted context and cyclic disasters. Really needed additional nutrition supplies and funds in order to provide the adequate NA programming for IDPs and other populations. A request for donor and INGO support, financial support specifically, to help with focusing on returnees and IDPs and gender inclusion. And also mentioned here, training and funding are needed to strengthen capacity. Also, sharing is important. I would love to hear more about the sharing piece. Colleagues, the floor is open if anyone would like to come in and speak more to this, or if you prefer to verbalize your thoughts about what support you could most benefit from, if it's easier than writing. Taking a look at some of our local and national partners who are on the call. Girma, I don't know if you'd like to come in. Faraz. Jelton. Would anyone like to come in? The floor is open if anyone would like to speak about opportunities. Yeah, I do see a question in the chat wanting to know more about strategic partnership. Here in the Menti, it's mentioned strategic partnership and training and development. What does, I don't know if the individual who put that would like to complement, but what would strategic partnership, what does that mean and what can it look like? I'd love some more detail on that. And for those who are just joining the call, I saw a couple people come in. Welcome. We are looking at the question, what kinds of support or collaboration would be most useful for you in delivering your nutrition and emergency services? Support can be many things, can be funding, can be partnerships, advocacy, capacity strengthening, supplies, can be just about anything. And this is a very open question. It's an opportunity to share with the GNC collective what kind of support would be most useful to you. This can be support from government, donors, academia, GNC team that supports technically. Very open question. And the floor is open if anyone would like to come in and speak to this point. On the point about strategic partnership and training development, thank you, Abdelrahman, for expanding on that in the chat, meaning collaboration or partnering with an aligned organization to amplify, reach, and share resources. That sounds like a very promising strategy. Sharing. Oh, we have another one in the poll, capacity building, contribute to SOPs, developing SOPs. Would anyone like to come in and speak to any of these? One in the Menti. Thank you so much, colleagues, for using the Menti. It's very useful. Seeing emergency preparedness, partnership and capacity building. Great. So in general, seeing some great incoming comments about a lot around partnership and funding, capacity strengthening. Great. So seeing some comments in the chat around specifically around partnership and this idea of aligning organizations to amplify each other and share resources, and some follow-up questions about, what support is really needed to make that happen, or is it already feasible, or is it in process? Hey, colleagues, I know we are getting closer to the end of the call. Just want to make sure everyone that wants to has had a moment to speak. Masako, please come in.
Hi, good morning. We're in Amman, so it's morning here. But I just wanted to, as we are talking about the collaboration and the support, I just wanted to give UNRWA's example to pilot and evaluate and scale up multiple micronutrient supplementation for pregnant women. As I know, it has been a kind of like hot topic globally. Just as a to portray our success stories, we collaborated with like multiple international partners, including Johns Hopkins University, Vitamin Angels, and Cook Humanitarian. They're the major drive in this effort. But we were able to conduct implementation research in Jordan to show the impact within our health system, concurrently comparing the performance of antenatal care system that delivers multiple micronutrient supplementation versus iron and folic acid, which was our previous standard of care. And then we were able to show that the acceptability was much higher among pregnant women. We also measured the side effects and adherence, which was improved with MMS. And then also we were able to look at the hemoglobin levels and response, which showed the reduction of maternal anemia in our pregnant women among Palestinian refugees. So we are, as an agency, decided to scale up MMS across all fields. That includes Jordan, Lebanon, Syria, West Bank, and Gaza. So I just wanted to mention this project to portray our success and processes that took to replace iron and folic acid with MMS. And we're happy to share more detailed process with any global entities or governments or UN agency that are interested in doing something similar.
Misako, thank you so much for sharing that. That's really interesting to see a success story of a collaboration and research and how that translates practically. Misako, I might have missed it. What is your organization? I think I missed it earlier.
Yeah, sorry, I didn't mention I'm a public health research specialist, a scientist with UNRWA Health Department, so UNRWA.
Thank you so much. Wonderful colleagues. Just checking the chat again. Yeah, Irma, thank you for the mention in the chat asking about how to make the partnership. I think it's a great question. Really depends on yeah, the needs and how to align and find the right actors to work together for a partnership. Thank you for sharing thank you for sharing the website for your organization. That's great. Okay, colleagues. We have about 10 minutes left. I am going to open the floor if there aren't any. Oh, great. We have also in the chat. Thank you, Dimby, the mention about hardware support needed to approach more the targeted person. Sometimes nutrition and emergency services are limited by the geography. Thank you, Dimby, for that very specific mention about a very specific piece of support that would be useful for your programming. So feel free to keep adding your comments to the chat. We will open the floor now if there are any international actors who would like to share based on local or national partners that they work with. If they have any knowledge of what support that would be helpful for their local and national partners. So we'll open the floor now if any of our international partners would like to speak on behalf of local and national partners that they work with. Opening the floor for that as well.
Alexa, are you expecting like even us from the global level to share something?
Yeah, sure. Yeah, if you're working for an international actor and you have any thoughts based on your experience with local and national partners, yeah, please come in.
Okay. Thank you. Okay, so yes, from what the colleagues have said in the chat, I mean in sharing through the Menti and what is projected, my brain was like gling gling, when I heard about capacity building and also preparedness and how to help to reach local and national actors. And I wanted to share with you quickly an experience we had with Sudan. I don't know if people from Sudan are in the call actually with a blended training. That's a hybrid approach where you have a few online trainers from the Global Nutrition Cluster and a lot of local and national organizations in the room doing online modules so they can actually regroup in UNICEF office to have network. And then we make the session and we make it like very practical and animated and fun, right? And at the same time, we take 2 or 3 people from Sudan, from the nutrition cluster, from the very beginning, and we try to give them the package that they can replicate. And this happened in Sudan with a lot of local and national actors and with very low bandwidth, and it worked. And now the team is actually repeating the blended training by themselves to their local and national actors in different hubs. So I really wanted to share that that's possible, and for me, I was quite impressed because the transmission of knowledge went fast and it was really nice and animated. So yeah, I really wanted to share this with you, and in case of need, we can help you to get this. Thank you.
Thank you so much, Geraldine, for sharing that example of a really concrete example of how capacity strengthening can be dynamic, can be fun, and it doesn't have to just stop with those who are trained. Capacity can continue on. So thank you so much for sharing that. I know that is one thing that the GNC team, we are able to support with capacity strengthening. I'm going to put the link to the GNC website. That is the piece that we're best positioned to support on is capacity strengthening. So putting a link in the chat if anyone's in need of technical support or capacity strengthening support, just on the website, there's a request support button. And yeah, would love to hear from you. And maybe we can think about doing sort of replicating what Geraldine was mentioning, some training opportunities. Great. And Duncan, I see you put in the chat as well, some capacity strengthening services we provide. Perfect. Colleagues, keeping the floor open for just a bit longer. If anyone would like to come in on any aspect of this. Oh, Martha, yes. Please come in.
I'm just curious if some of the LNAs are getting support from their fellow LNAs or from government entities or aspects like, the Red Cross, the Red Crescents. Are people really getting that support or that engagement during this period? Have they seen some changes where, like the Red Cross, other LNAs are really, really trying to come in and be supportive of them, or better engagement and better working together? And if this is happening, could they share some examples? Thank you, Razan, for joining us. We will be sharing with you details and hope you can join the third session. So are we seeing any more, or at least strong engagement within LNAs or among LNAs or LNAs and government bodies? Hey, I guess it's probably not. Oh, back to you, Alexa. Thank you.
Yeah, thank you so much, Martha, for asking the question though. Actually, I know during one of the calls in session 1, there was a really interesting case study that maybe we could even follow up on Somalia, where they were talking about local and national actors sort of coaching or mentoring other local and national actors, which I thought was super, super interesting. It'd be interesting to learn more about that. I see another comment in the chat coming from Ali. Support to engage, financial support to engage in nutrition in some of the desert regions in Somalia. Thank you so much for sharing that. Looking to big partnership. Okay. Thank you, Ali, for adding that. I recognize we're coming to the top of the hour. So just want to, again, thank everyone on behalf of the GNC Anti-Racism and Localization Working Group. Your engagement in this conversation has been really valuable. I hope it's been a valuable space for everyone here. This is a really critical moment of change for the humanitarian sector. And we want to make sure that there are spaces for nutrition and emergency practitioners, but especially local and national actors and their allies, to engage in dialogue that both helps us understand what the situation is like currently, but also helps us to imagine and work towards a better future. And that is what session 3 of the series is going to be all about, is looking to the future. So just want to reinforce that your leadership and your insights during this call have been incredibly valuable. And we're going to be sort of summarizing what we're hearing, mostly anonymizing, and it's going to be included in a report. Our idea is to, it's okay, Jacinta. Our idea is to summarize what we're hearing from local and national actors, local and national partners, into a very brief report from across the 3 sessions, and trying to share that far and wide as a collective good. And we hope that will be useful. And we hope that this can be useful to everyone in the humanitarian space, specifically for the GNC. This means it's going to influence how we action the GNC localization roadmap. It's also, your insights and your thoughts and the importance of local leadership is going to be something that influences the next version of the GNC strategy. So very important to us, and we hope very important to others. As always, if you are ever in need of nutrition and emergencies technical support, please don't hesitate to reach out to the GNC. We have that request form on the website. And feel free to reach out to us or speak with your end country nutrition cluster team. We're here for you. So thanks so much, colleagues. Martha, anything else before we say goodbye?
No, thank you so much, and hope to see you guys in the next session. And if you do have anything else, please do not hesitate to share with us either through email or even join us in the afternoon session if you can. And hopefully we'll see you in the third session, which is our final session. Thank you so much.
Thanks so much, colleagues. Bye.